Welcome to the Cure PDX Podcast, where we share insights, methods, and strategies for a less polarized, less violent, and more humane world. I'm your host, Ryan Akade. Today I'm talking to Brent Decker. Brent is the Chief Program Officer at Cure Violence Global, a nonprofit that uses a public health approach to stopping the contagious nature of violence. Cure Violence Global, abbreviated as CVG, is the lead organization of the Cure PDX project. So I thought it would be fitting to have Brent on as the first podcast guest to help familiarize people with CVG's method of de-escalation and violence interruption. Here, Brent explains CVG's public health approach, the role of credible messengers, violence interrupters, and outreach workers, specific skills and techniques used in violence prevention, success stories from around the world, and the novel challenges of applying this method to stop political violence here in the Pacific Northwest. Thanks for tuning in and hope you enjoy the show. I am here with Brent Decker of Cure Violence Global. Brent, welcome to the podcast.
Hey, thanks for having me.
Yeah, it's been a pleasure to meet you and be working with you for the past, 8 months or so. And I'll also say Brent is also my boss. And so it's really been a pleasure to be working with you on the Cure PDX project.
Yeah, likewise.
And so, given that you're the first guest on this podcast series, I want to start with you explaining what is Cure Violence Global and what is the public health approach to combating the spread of violence.
Yeah, sure. So I will try and do my best to give a concise answer. I've been with the organization for 20 years as it's kind of developed. But essentially, so Cure Violence Global was started back in the late 90s by a physician named Dr. Gary Slutkin, and he was a infectious disease specialist who was at the World Health Organization, and he worked many years in tuberculosis, HIV/AIDS, and kind of came back to the U.S. in the mid to late 90s. And this was, again, a time like now where there was big peaks of violence, and I think the country was really debating or discussing like what to do about it. And this is like Clinton era administration type stuff. And as a little context, I mean, organizations like the CDC and the World Health Organization had declared violence a public health issue dating back to the 70s, right? And had done a lot of thinking about it and work about it kind of in broader strokes and kind of some of the more systematic levels of it, right, or implications of it, and what Dr. Slutkin did with a number of other kind of physicians and community health specialists is take what we know in public health, but specifically around epidemic control, and apply it to violence, right? And so that's three things that you do in any epidemic control program: is you interrupt the transmission, prevent future spread, and change group and community norms, right? And so this is for like, we're thinking about the most acute cases or the most acute scenarios where violence is the highest, right? And so in the first part of interrupting the transmission, this is where the idea of the violence interrupter came forward. And these are folks who are from a community, from groups that potentially were involved in violence, and their job is really to use their relationships to identify and detect when conflicts are brewing, and use that same relationship to try and step in and either mediate the conflict, shut the conflict down, or if something does take place, use that same relationship to try and prevent retaliation, right? And so this is like kind of the tip of the intervention, right? The first part of it is really trying to interrupt the transmission, to really trying to stop the back and forth of violent events that are occurring at a community level, right? So that's the first part of the intervention. The second, in terms of preventing future spread, this really gets to what we know about really behavior change and working more long-term with folks that are likely to be involved in violence. And so we have a category of workers called outreach workers. And in a lot of other scenarios, they're known as like community health workers. I mean, this is very kind of common practice around the world, not so much in the US, or it wasn't. And the outreach worker, their job is really to work, again, more long-term with folks that are likely to be involved in violence. And again, they come from the community, many times have had very similar experiences, or family members have, and are really trusted and credible, right? And they work, like I said, long-term, of really trying to help folks with whatever they might want help with, right? but really focusing on changing some of the behaviors by building the skill sets and providing more information for folks not having to respond to violence so quickly, if that makes any sense. Like that's instead of the first option, maybe it's the fourth option or the fifth option. And then the third part of kind of our approach and in the epidemic control model has to do with changing group and community norms around the acceptability, in this case, of using violence. And that's done through public education campaigns, that's done through different events, different messaging. And it's also done by kind of interjecting this idea of being able to have kind of a community infrastructure in place. And what do I mean? I mean that like before interrupters and outreach workers are working, if you and I are into it, there's really no one for me to call. There's, you know what I mean? There's no kind of infrastructure. I'm not going to call the police. I'm not going to tell my teacher, you know, like that's not even an option in most cases. And so where some of the kind of community norm change happens is when there are violence interrupters and outreach workers who are from there, that know the community, that are trusted, folks start to reach out to them, right? This becomes a new norm. Like instead of us just being at it, we're able to reach out to someone, and that's step one. Step two is even agreeing to be part of some sort of mediation process, right? Is kind of a new behavior, a new norm, and abiding by these conflict, you know, abiding by these interruptions or mediations are kind of new community norms that might have existed before, right? Before the war on drugs and all these other things, but you know, and many times it's almost like a revisiting of how communities have dealt with stuff before, right? And so I think that's really where we get to some of the community norm change about it. So that's at a very high level, the approach, you know, as we understand it, and it kind of being a epidemic control within the public health lens of violence prevention.
Excellent overview. So let's start with how Cure Violence Global finds these credible messengers or violence interrupters, right? Because you kind of have to find the right individual who's down with the mission of the project, but also has these connections or strong ties to people in their in-group such that they have the credibility with them to de-escalate something if something comes up. So, what you know, Cure Violence Global has done work all over the US, all over the world. So you go to a new community, how do you find these people to be these violence interrupters?
Yeah, well, I mean, I think the first part is like the way that you go. And so we really only go places that were invited, either by like a city, a community group, a partner like USAID, you know, it just kind of depends. But we have a whole kind of initial process of really trying to figure out, we call it like a readiness assessment of trying to think about if we were to partner and work in an area, how would we best do it so that it could actually be helpful, right? And so part of that includes like what it would be the oversight agency. Is this out of a health department, right? Is this out of a, you know, is it like who's kind of funding and doing some of this stuff? Who are some of the community-based partners that are doing similar work, that have the types of relationships in the communities that violence is most acute? Looking at some of the data to see like where the areas that over time have really experienced these high levels of violence, and then finding a way to figure out a pathway to identify, you know, select and train the right workers, to your point. And so it's often a process that's done in collaboration with existing community-based organizations or health departments or institutions like that have already been doing either similar work, adjacent work, or other health work in a context with a lot of violence. And so I would say finding workers to do this is usually not the hard part of it. And that might sound strange, but there's like an untapped resource in most communities of folks that have been involved in violence and for many reasons no longer are, and are already trying to address it in other ways, right? So it might be a boxing gym, right? It might be through the church, it might be through a mosque. You know, there's a lot of different ways, but there's a lot of folks that have kind of like maybe been there and done that. They might have, you know, gone to prison and come back, that are already trying to do this. And I think the best workers who end up being violence interrupters and outreach workers were already doing something similar kind of on their own. And as they join some of our partners to do it, they get kind of more training, be able to get some support, and it becomes a bit more like strategic and in that sense of like and collaborative. So I think it's really just a process. And so once we kind of know the areas, once we know kind of where violence is most acute, then it's really about, like I said, engaging groups that are already doing work or already having some kind of footprint on the ground. And then from there, really working together to figure out who would best be the worker. Because what it comes down to at the end of the day is credibility. And credibility with who? Not with me, not with like a social worker, not with the mayor's office, but credibility with those who are most likely to be involved in violence. That's who the workers have to be credible with, right? They can't be seen as like snitches or, what I mean? Anything, they have to really be understood as like being credible and really looking out for those members of the community. And so it varies in country to country and context to context, who those credible workers are, who has that credibility and who can really engage folks in a way that's like natural and makes sense and is like real.
Awesome. All right. So you're invited to a new location. You find and hire these individuals who are credible in their respective circles. Give us an overview of some of the resources, support, skills, and trainings that Cure Violence Global then provides to these people.
So the first thing is what we try and do is when we're talking to a jurisdiction, like either a city, county, country, community, whatever it is, it's like making sure that there's some local commitment for funding, over time. So we're not trying to like set stuff up for like a pilot program, because I think, we're in this field, like we're like well past that, even though not every city agrees with that, but we're like past this idea of like, does this work or not? It works. It's about making it work. Right. And so the first thing is really trying to ensure that there's resources to pay the staff. So just to clarify, we don't hire people. The workers are hired locally from local existing community-based organizations that's usually funding either from a city, state, private, whatever it might be. But we really want the money to kind of stay local, right? And so that's so really trying to set up that funding structure so it becomes part of a way that a city or county or country does business, right? That we support this part of violence prevention and invest in it like long term, right? And so once folks are identified, there's a whole process of the interview process to make sure we have workers that are both credible and suitable and kind of no longer involved in whatever that violence was before, but still maintain good relationships. And so once they're hired, and that's a collaborative process, there's 3 to 4 weeks of initial training for different levels of the organizations that are doing it. And so there's a first training for the community-based partner and whatever the oversight agency is, that kind of goes through the model in detail, the roles and responsibilities, hiring best practices, management best practices, and really just like lays the foundation for an organization to kind of take this on as part of their work. And even if they were doing something very similar, it's just good to discuss like some of the main points of it so that we could like together work out how this gets adapted or implemented locally, within their organization. Then the managers go through a week-long training that has to do with the approach, some of the things that we call the pillars of management, like how to do this day to day. How does this fit into your already existing operations? And then there's a training for violence interrupters and outreach workers, which is another week. And then there's a database that we use to capture the work. We never take folks' names or addresses or anything like that, but it's really about capturing like what are our workers doing, so that we can kind of overlay that on official data to try and measure what impact we might be having at a community level. And so once folks are trained up, kind of gone through this process, then they start implementation. And then we work with the either city, county, and the local community-based organization for the next couple of years, weekly calls, monthly data reports, booster trainings. I mean, we really see it as an ongoing partnership in the initial years of implementation so that we can kind of transfer everything that we know from the work around the world to whatever community is doing that work. And so folks have kind of all the best practices, all the best information, so they can be kind of synthesized and understood locally. So it's based off of the way that the World Health Organization works with different countries. It's not like come to a training like good luck. It's a really in-depth partnership that goes on for years.
Awesome. Share some stories with us about how some of these methods or skills were put into practice to successfully de-escalate or prevent acts of violence or change norms in the long run away from ones that espouse or condone violence.
Yeah, there's a million stories, but most of them go like this, right? Like, because when we do it right and we're working in an area that has that level of violence, and you get the right workers, one of the things that we do, and I'll just talk about Honduras for a second. So we were in Chamalacon, or we still are, which at the time when we started in 2012 was the most violent part of the most violent city of the most violent country on earth, right? And what we did in the first initial trainings was we listed out like what are like the top 50 reasons why people get killed in this neighborhood, and then mapped out of those 50 reasons why people were being killed, like what was possible to address today, and so sometimes people get very uncomfortable with this. It's not that we're condoning the other acts of violence, but we're thinking about this kind of pragmatically. Okay, where do we start? Because we start day one like, hey, like we're coming to stop violence between you two, like, international gangs, like you're dead, you're not making it out of that conversation, right? And so what we were able to kind of like map out and think, okay, what were some of the things that maybe involved kids, that involved the community a little bit more, and to start the process there, right? And so that, because part of the idea of changing norms around the acceptability of violence is A, mapping out what those norms are, and B, like what's the starting point? Because I think a lot of times folks are like, oh, we're gonna do mediations at this like very, very high level, and that's just like not like realistic at all. These are, in the case of Honduras, there's a lot going on there. There's like local community gangs that are attached to international gangs, that are attached to international cartels, that are attached to governments, that are attached to, what I mean, this whole thing. And so if you can get very much lost in that, and so we really thought about, okay, what are some of the lower hanging fruits? And I hate that phrase, but you know what I'm saying? Like that's like a MBA like 101. I mean, but like what are some of the things that we can actually address and then kind of build momentum from there? And so what we understood is that in the community, although that was the context, there's a lot of stuff happening in the schools. There were a lot of stuff happening between community members. There were a lot of things that were happening that was just because this person came from the other neighborhood, I'm assuming they're another gang, so we're going to kill them. You know what I mean? And so the workers really tried to work to get some of the stuff that wasn't so quote unquote necessary off the table. And it was, it was very hard. But I think one of the things that came up real early is one of the leaders of one of the, gangs, I won't use names or anything like that, said to one of our staff, like, look, for me, I know I'm done, but I don't want this for my kids, and so anything you all can do to help, like we're in. And I think that gets to kind of some of the narratives and understandings we have around violence that's not correct. We think, I mean, even dudes with like the full face tattoos, I mean, I think we have these like really weird narratives around it, not understanding these are just like humans that are in a situation and have been exposed to violence and not a lot of options and maybe some bad decisions. But it's, I think when we saw that and heard that, we knew it was possible, that we're not going to solve every single issue of violence, but we can reduce a lot of it, and then as you reduce number of events, you reduce exposure. And what does that do? That in terms of like kids and, and how they grow up, and so that's how we kind of started in Honduras. Other places like Iraq, when we started, we were working in southern Iraq in Basra, and what's interesting there is what we were able to do, and by we, I mean us and our partners, not like me, in the trainings and as we were kind of figuring this out, understood the role of the tribal system there, in terms of just like that's a way that folks like naturally and have historically organized themselves. And what happened before is that if two people got into it, over a generator or over, livestock or whatever it is, and there'd be kind of violence back and forth for a while, and then finally the tribal leader would kind of step in and try and resolve it, which is awesome. But what we were trying to do with our partners there, who were Iraqi, right, were convincing the tribal leaders to intervene sooner, right? So that, you know what I mean? Like they had they had the authority, they had the skill set, but part of the norm was like letting it go on a little bit before they stepped in. And so part of the work of the workers was really trying to support them to like not let it go back and forth so much, and to really try and mediate stuff or step in before people get killed, And so I think, again, it traded on the existing community infrastructure, and it was just about supporting folks and equipping them with some of the skills and training of how to accelerate that process a little bit so that it could prevent deaths that were unnecessary. And I think the thing too is like, this is always an easy ask. I mean, what I mean? And this is, I think, again, gets to kind of our mindset when our understanding of violence is like 9 times out of 10, folks don't really want to do this. You know what I mean? Like, it's like, yeah, of course, there are instances where it's like an assassination or whatever, but like most of the community-based violence is folks don't have a lot of options, often don't have skills to address things otherwise, and the peer expectation on them, on all of us is a heavy thing to carry, and so a lot of our human behavior, I mean, most of it is to impress our peer group, right? Or to be belonging in our peer group. And sometimes that includes like really heinous acts of violence, but it's the same thing that's going on in our brain in terms of wanting my friends to think I'm cool, and it's not to minimize it, but it's a similar process that's going on. And so when we tap into that and work with folks to give kind of face-saving opportunities and other options, them to be involved in such brutal violence, it's sometimes not that hard of a sell, and I think that's the good news in this work, is that I think, when done correctly, when we have the right workers, I mean, most folks can be reasonable, and if they're given the opportunity and given the support needed, different decisions get made.
Totally. So I want to talk a little bit about the differences between environments that Cure Violence Global has traditionally worked in addressing issues of community-based violence, and the differences between community violence and the Cure PDX context, where in the Pacific Northwest, we're trying to prevent specifically ideological and politically motivated violence, which to me, it has a lot of similar characteristics as community violence, but has some very distinct differences, including the geographic scope we're trying to cover, including people organizing along ideological lines via social media and the internet, right? So the spread of individuals involved in these groups is more diffuse and spread out over a large span of terrain, right? So I think there are some key differences, right? Maybe less instances of physical violence, but there are other kind of hostile tactics that different groups use against each other, like doxing, harassment, that kind of thing. So just in your experience, what are some key differences between conventional Cure Violence Global community-based violence work and preventing, political or ideologically motivated violence in the Pacific Northwest?
Yeah. Well, I mean, I think first and foremost, every time we've kind of adapted the approach to other contexts or other kind of scenarios, right, or other types of violence, there is a big learning curve. No, not necessarily in the idea, but in the application of it, right? And so I'm gonna talk about one thing first, then I'll get to your answer. But like, so in Latin America, with some of our partners, this issue of gender-based violence and understanding actually all violence as gender-based violence, but specifically in Latin America, like, what were the teams doing to address this? And so we really had to learn from experts in the kind of gender-based violence space to think about where it intersected with what we were already doing and what kind of additional training and support was needed for workers that were doing just kind of general community violence to understand some of the dynamics around gender and those things. Same thing with electoral violence that we did in Iraq, so, in other places. So I think we think about the Pacific Northwest, I think first and foremost, you're right that it's less number of incidents over a much broader geographic as well as ideological, i.e. reasons why people do things spread, right? And so I think we have to be A, in a learning mode always, but B, it's a much broader kind of approach, if that makes any sense, in that it's harder to identify and detect conflicts that we could actually step into and mediate, because there's so far fewer of them, and they are in a much broader space, and they also exist online. And that's not to say community violence, like most of that comes from online stuff too, but it manifests itself in very specific geographic areas that are predictable based on previous years, right? So they're still happening in the same spots, but it's like the internet's just kind of like the new public square, if you will, and so that's very similar. I think the challenge and what we're working on together on this project is, given a much broader geographic spread, and we have to think about it in much more general terms, and a lot more folks, I think a lot more folks are more apt to be violent, but at a much lower frequency, if that makes any sense. You know what I mean? Like, a lot of us are into real crazy ideas, myself included, right? That, you know what I mean? That like, that believe, right, that violence is acceptable if a certain line or a certain thing is said, or, you know what I mean? And like, and so I think there's a lot more folks that potentially could be involved in violence, but there's a lot less of them that actually do it, if that makes any sense. You know what I mean? And so it's like, it's a different balance of trying to figure it out. And I think what's been exciting about thinking about this from a public health lens is the same way that we're not trying to be like judgmental of folks that are involved in gangs or crews or militias, and work with folks where they're at, is the same kind of lens we're putting at some of the ideological stuff, right? So there might be someone with like ideas that, like, me personally, I'm like, that's, you know what I mean? Like, that's, I don't accept that at all. But if we're really trying to like prevent violence, folks need to be worked with and supported to, you know what I mean? To try and like, to engage where they're at and not be judgmental, and not be like, oh, you're, a fascist, so whatever, you know what I mean? Like, and so I think there's where the public health approach can be helpful, is that we are trying to meet folks where they're at. I mean, the same thing in Honduras. Like, I don't agree with like killing people ever. Do you know what I mean? But you know what I'm saying? Like, but we got to work with the folks who are involved in violence to try and support them and make different decisions. So in the same idea, if someone's part of some whatever X ideology it is, you know what I mean, that I totally disagree with, still got to meet folks where they're at, and still got to work with them to think about this issue around violence. Our ask in the community violence is not to like stop selling drugs and stop being part of a gang, or don't be part of this militia. The ask really has to do with, how can we do this with less violence? Can we do this with no violence? And so I think a lot of the ideas and methodologies are very applicable, but I just think we're still working on how to do it kind of in a broader scale with less actual number of incidents. And that's where I think like the norm change work is important. Like, this idea of like, as opposed to, and again, sometimes people don't like to hear this, but as opposed to trying like to get that kumbaya moment, right? Because there isn't necessarily going to be one, is like, how do we get folks, even that have, ideologies that, you might personally think are abhorrent, like, to stand down on some of this stuff and to kind of position their stance on violence, right? You know what I mean? And so I don't know. I think those are some of the things that we're working to think through. But I think a health lends itself to doing that, especially when the violence is, quote unquote, ideological, right? Because it's like, if we can move away from, you know what I mean, of some of the ideological battle and get to like the practical, okay, so what? But does this mean you have to do X, Y, and Z? I think is sometimes a more fruitful conversation than trying to like uproot someone's, beliefs completely.
Yeah, that makes complete sense. And you said something that to me is extremely important, and that's meeting people where they are and taking baby steps, micro steps forward, and not imposing your ideas or your ideology onto individuals in the community that you have no relationship with. Like, you're kind of parachuting in there and telling people how it is, right? Rather, we're meeting people on their own terms and talking to them in a way where they can understand or resonate with what we're saying. And so I think that's just a really important part of the work in doing that. I also want to ask, to go back to the example of the guy in Honduras who's like, I'm out, but I don't want my kids being caught up in this, right? What are some common motivations you hear from people who are really dedicated to this violence prevention interruption work? Like why would they be motivated or inspired to put themselves in a potentially dicey situation? Like, what are the range of motivations you hear from people and why they care about this?
I mean, I think it has to do with, it's a lot of different things, but mostly folks who've been through it and been there know what it actually is and understand that this is no way to be, that like, I oftentimes, we glorify violence and, you know what I mean? And all of us are involved in like jujitsu and stuff and into fighting and, and these type of things. But the reality of it at the end of the day, the brutality of it, and the real like, of really being around death and really, you know what I mean? Like it has an effect on people. And I think folks oftentimes didn't see other options or it was economically motivated. And then when they get to a space where that's not the exact thing and are able to reflect on some of the crazy stuff they've been through and seen, I think often are highly, highly motivated to try and prevent their family, their communities from having to go through that, and so I think, sometimes it's spiritual reasons, sometimes experiential reasons, like I'm mentioning. I think, mostly, as much as folks might not say it, I think it's not normal to be in those situations and to have to experience that. Do you know what I mean? Like it's really, and I have personally not gone through that, at that level at all. But most of the workers have been through there and done that, like, would move mountains, you know what I mean, to not have to have other folks have to go through that, and so I think it's usually a very personal motivating factor, you know what I mean? Like it's definitely it's never to be cool or make money, because that's not in this field at all, but it's usually like highly personal, based on really powerful and brutal experiences. I think one of the points, the reason that Cure Violence Global is even doing any of this work is that we've tried to have this approach be evaluated. So there is some sort of scientific, quote unquote, depending on your views on that, but evidence for this approach being important as part of a broader strategy. And so if you look on our website, the model's been, evaluated in many different circumstances in many different countries, and it's been shown to be effective. Is it the solution? The solution? No, but it is part of a solution. And I think as we're thinking about violence and violence prevention, the role of like a health approach is important to be part of it. I think obviously the economic situation of folks, that drives a lot of the violence that gets associated with like informal economy and stuff, the highly traumatic experiences folks have, like for sure, you know what I mean? The context is everything. But what to do about it and what are some of the things that we can do in the here and now, I think the public health lens has, it opens up a lot of things. It opens up a lot of space, and it's a good way to think about violence prevention and how communities, whatever the community is that's like involved in violence, either sometimes a little bit or all the time, like has a really critical role in its prevention, and so it's not always we have to call an outsider to come address this. It's really about supporting folks that are already there, already part of the community, to kind of work with our own communities to try and prevent some of this stuff. And so it's been shown to work. And so it's not perfect and doesn't work every single time, but by and large, all the evaluations on it have shown it to have some impact.
Brent, thank you. Thanks for telling us all about Cure Violence Global and letting us know about a core aspect of Cure PDX's methodology to prevent the spread of political violence. And thanks for your time today.
No, thank you. Thanks for having me.
Thanks for joining us today. If you want to stay up to date with the Cure PDX project, go to cure-pdx.org. Again, that's cure-pdx.org. And if you want to talk more about trainings, dialogues, events, or anything related to the Cure PDX project, email us at curepdx@cvg.org. Again, that's curepdx@cvg.org. We look forward to hearing from you.